Gil Paddock from upstate New York has been suffering from multi-level spine pain for decades.
I was a New York State trooper for 20 years. During a severe snowstorm, I fell down the front steps of the barracks. And I hit a cement step, about 12 steps, and I hit the cement step with just above my gun belt. 34 years old, you're tough, you walk it off. Well, I walked it off all right, but the problem is I started getting, unbeknownst to me, a degeneration, and things started happening, and things started coming apart. I ended up going to a chiropractor, and he put things back together for me, somewhat, and was suggesting, well, maybe someday you're going to be having to have a fusion. I said, nah, I got to keep going. So I think it was 1984, I was raising a garage door, and I just blew a disc, and I had all kinds of trouble. They put me out of work. I was in my 20th year of serving. I had already started building a campground. I do all my own work, electrical and everything. And I had to take a back seat to that and let other people do it.
His pain was centralized in his lower back, just where his gun belt sat. Physicians told him he may need a fusion surgery in the future, but he saw the horrible results of friends who had fusions and knew that was not an option.
I was not about to go over and come back like the other guys were. One of the guys, I was on the diving team at the time, scuba diving team, and one of the guys that was on the team with me was muscling a Boston whaler around by himself. He ended up hurting his back, went over to, he came back twice as bad as before he went over.
Gil was being treated by Dr. Joel Santee of Adirondack Region Chiropractic. But when Dr. Santee knew chiropractic could only provide Gil with limited relief, he introduced Dr. Bonatti to take the next steps.
Most of the doctors and physical therapy people up there just don't realize, what's involved and what's going on. Dr. Santee, he did what he could. Made me comfortable. Times I went in there, I could hardly walk in. I'd, limp out and whatever. But like I say, for 40 years, I couldn't touch my toes. I had back pain all the time. He brought Dr. Bonatti up to Malone, and I went to the seminar, and Dr. Bonatti was showing, how this worked and I'm sitting there going, that's me. Everything he said was me. He was right on, and coming down here, three years ago I had 3, 2 years ago I had 2, and I was great until this past March. And I bent over to pick up something, and I blew a disc. And in the L5, same area that had been damaged, and that's why I ended up coming down here.
After developing new injuries, Gil returned to the Bonatti Spine Institute for additional procedures in February 2020 for treatments on his low back and a couple in his cervical spine at levels C5-6 and C6-7.
This time was because of the blown disc. And I also had developed some problems up in my neck. Couldn't turn my head and whatever, and I had tingling in my fingers. I had 3 operations this time. I had 1 for the lower, 2 up here, 1 on Thursday and 1 on Monday.
On consultation day, neurosurgeon Dr. Robert Uteg met with Gil to discuss his diagnostic imagery.
In his case specifically, we worked in the lumbar area at L5-S1. Gil had stenosis. Stenosis just means narrowing. We planned to do a bony removal, and what we usually find is the inframedial facet is resting or abutting against the nerve. When people are laying down, it's not such an issue. When they get up and walk or are on their feet for a while, then that tends to sag in and push, the bone tends to push against the nerve. Patients will frequently exhibit pain that travels from the back down into the buttock and back of the leg. And it can happen within just a few minutes of being up and walking. In Gil's case, by making about a 1-inch incision and using a high-speed drill to remove some of this bone, we could see the nerve sac and the nerve branching off. Then using a combination of a drill and sharp biting instruments, we can bite away the bone that narrows the nerve exit path. The next step at the end, when we think we're done with surgery, is to ask the patient to get up on their hands and knees and wiggle and move in a way that they couldn't have done so prior to surgery without having pain. And by establishing a few millimeters of clearance around the nerve, we can be reasonably optimistic that when a patient goes through their activities of daily living up and down and all their activities, that the nerve will remain well decompressed and they will not have the traveling leg symptoms.
Going over, looking at the MRI and explaining to me what was wrong and what could be done and what they felt would take care of it made a lot of sense to me.
The Bonati spine procedures are performed using conscious IV sedation. This allows the patient to be an active participant in their own surgery and have none of the side effects associated with general anesthesia.
They directed you and helped you. It was, I don't want to call it weird, but it was something that I've had operations, all kinds of operations, shoulders put back together, bicep tendon put on, all that stuff. I woke up in the recovery room. What they use, I call it happy juice, but it was no repercussions, no sickness like I had in other operations I've had, no after stuff. It's just, he's got a handle on it, top notch, as far as I'm concerned. Dr. Uteg has done all my surgeries, and the second surgery I had, when I couldn't get out of bed, they brought me in here. The hotel staff had to help me get in the car. They put me on a gurney outside, took me in, did the second operation that they were supposed to do, and at 4:30 I walked out the front door.
Gil is only one day out from his final surgery and is ready to get back to work in New York.
Just incision pain is all I got. I don't have any pain. He's got me good. I just got to go home and take it easy for a while and build up some strength and whatever, and not aggravate anything. But
when asked what he would tell others about his experience at the Bonati Spine Institute, Gil noted,
"They're absolutely phenomenal. Dr. Uteg, the girls have got so much compassion, and you tell them something, and somebody else needs to know about it. They're texted or they run right over and tell him he said this or this and that. And I mean, the coordination in here is outstanding. It's a team. And Dr. Bonati's put together hell of a good teams. Do what they say, and like I said, they've got it down to a science. They got it. They nailed it.